If you feel sick, wear a mask. But do me a favor and don't steal them from the hospital. The numbers keep going up, testing is limited in the United States, and no one quite knows what is going on. This is what is really happening with the COVID-19 outbreak. Hey everyone, my name is Dr. Wagner. I'm a board-certified emergency medicine physician, and on my show, I answer your urgent medical questions and clear up myths about certain deadly diseases. If you haven't already done so, make sure that you hit the subscribe button and turn your bell notifications on. That way you are instantly alerted when I post a new video. I'm going to be frank today. The news and non-medical social media has made the virus into the next apocalypse. There is so much false and misleading information out there. Yes, things are changing every single day and new information about the virus is coming out daily, and we all need to pay attention. The mass panic has now caused the stock market to become volatile, and come on, the grocery stores and Costco are running out of the daily products like toilet paper that we all use and need. For that reason, I'm going to be straightforward and answer the questions I get asked every single day in the emergency department. Number 1, is the coronavirus airborne? No, not in the true definition of airborne. It does not linger in the air for hours, but rather it spreads person to person when someone who coughs, sneezes, or even talks allows the droplets to go into air, just like the flu does. With droplet transmission, viruses are released in the respiratory secretions when a person with the infection coughs, sneezes, or talks and can infect another person if it makes contact with the mucous membranes of that other person. Infection can also occur if a person touches an infected surface and then touches his or her nose, eyes, or mouth. Droplets typically do not travel more than 6 feet or 2 meters and do not linger in the air. Number 2, is the coronavirus more deadly than the flu? Yes and no. Here's why. Technically, the flu has sadly killed more people. In 2018, 93 people died daily from the flu, and there have been 20,000 plus deaths since the start of the flu season this year. That's way more than corona. However, on average, the flu death is about 0.1%. 0.1% of people infected can die of the flu. The coronavirus is still a bit up in the air, but some experts report that the percentage is about 2 to 3%. However, the other fact that comes in is, are there more people infected that we aren't actually testing? Thus, would that lower the death rate percentage? But as of right now, this is a bit of an unknown factor. Number 3, who is at risk? For the COVID-19 specifically, those over the age of 60 are at the highest risk, along with people who have pre-existing medical conditions such as asthma, diabetes, and heart disease. Those in the age group under 40 are around less than 0.5% chance of leading to death at the time I'm actually writing this. Number 4, is it a pandemic? Well, the definition of a pandemic, according to the World Health Organization, is technically a disease that is around the world in every country, or a majority of. Currently, COVID-19 is only in a handful of countries, but it is spreading, and the World Health Organization declared it a pandemic the day that I'm filming this. Number 5, can the coronavirus go away on its own if you become infected? Yes, the majority of patients who come down with the disease, they may not even show symptoms. Therefore, if they don't really realize that they have the disease, it could just go away on its own. Number 6, is there a cure? Currently, no. Some say it may take a year or 2 for a vaccine. That being said, there's currently a flu vaccine and a lot of people don't even get it. Why? That boggles my mind as a medical professional. If they do come up with a vaccine for the coronavirus, who's to say people will or will not get it? That all being said, there are things that you can do to reduce your symptoms. If you have a fever, you can try to take anti-inflammatory medications like ibuprofen, or if you have nasal congestion, you can try a nasal steroid to reduce inflammation in your nasal passageway. They are not sure if a sauna can actually help since it only uses external heat versus your own internal heat. Number 7, can the virus live on objects? Yes. Like I mentioned before, if you say, have the virus, then sneeze in your hand and touch a door handle, and then your buddy comes along and opens that same door touching that door handle is where the virus is living and spreading at that moment. So make sure that you wash your hands, make sure you wipe down commonly used surfaces and spaces that are often shared with other people. Number 8, what are the symptoms? The symptoms range from no symptoms at all the way to flu-like symptoms. The coronavirus attaches to your cells and in short causes a lot of mucus causing problems in your lower respiratory system. More often, the symptoms are very similar to the flu, shortness of breath, fever, and coughing. And in some cases, patients will even experience GI issues. Number 9, is there a test I can get? There are a few tests available. However, I work in the ER and currently we have specific testing criteria to actually test somebody. You have to have symptoms and you have to have risk factors for exposure to be tested right now. Think about this. You have a cold-like symptoms, you're coughing, but you're relatively okay. You are otherwise healthy and you just want to get tested just to know. You may have the virus or not. You decide to go to your doctor's office or the ER even. You aren't protecting others by wearing a mask and you cough in your hands and you touch things without realizing it. You have now exposed everyone in the office and or the ER waiting room and staff. One more thing to think about. Say you are healthy and young and you do get the coronavirus. You tested positive for it. But since you weren't sick, the staff members at the hospital that you went to probably didn't have on the elevated protective gear level for the coronavirus, but rather the normal protection. These staff, doctors, nurses, techs, and all the other staff will be required to be quarantined. If we do this often enough as a society, there won't be anyone left to take care of the everyday patients that come to the ER that need life-saving emergent treatment to which they will die if not taken care of. So if you suspect that you have the coronavirus, make sure that you first call the Center of Disease Control hotline or your local health department before going to the ER. This will help curb the spread of the infection to doctors, nurses, and other patients who happen to be in the ER at the same time. If you do happen to come in to get checked for the coronavirus, please let somebody know before entering into the ER. Number 10, do masks work? The common surgical masks do not necessarily work in preventing you from getting sick. However, these masks do help prevent someone who is sick from sharing their illness with everybody else. So if you feel sick, wear a mask. But do me a favor and don't steal them from the hospital. Also, the N95 masks are prioritized for hospital workers as they are on major short supply. Number 11, what works to prevent getting the virus? Good, normal personal hygiene. That is what prevents this. We need to be cleaning and washing our hands for 20 to 30 seconds every time. Don't feel like counting? Sing a song like Row, Row, Row Your Boat. Also, don't touch your face. Don't shake hands with others and don't touch handrails and other things that might actually have dirty germs on them. Use disinfection wipes or soap and water to clean surfaces and your phone. Number 12, should I go on my trip that I paid for already? The best thing to do is to look at the CDC travel advisory website to find out which countries are on alert versus not. Then it is on an individual decision to travel or not. Where you go, however, take your medications with you and realize that there's always the potential of getting stuck somewhere or getting sick and being quarantined because of all the events that are happening. But you can also get the virus from other public outings, such as going to the grocery store. So just be careful and cautious and practice good, proper hygiene and awareness. Just to be aware, the CDC just released March 11th that they do not recommend anybody going on cruises. Check out the CDC website, the World Health Organization website. Another good resource is the Johns Hopkins University medical website, which has a ton of information about the coronavirus as well as the surveillance. All right, that's been the answers to most of the questions that I get about the COVID-19 outbreak with me, Dr. Wagner. Make sure you leave me a comment below if there are any medical questions that you want to know about. And as always, make sure that you subscribe to my channel and turn your bell notifications on. Thank you so much for watching. Stay healthy, my friends.